Suppose someone is having a heart attack. Did you think of a man or a woman? Most people we ask this question will almost certainly tell us that they thought of a man. See what happens if we Google heart attack. These are the photos we get. Almost all the photos are of middle-aged men. It is often thought that heart disease is more associated with men than women, but this is not the case. The fact is that in some pathologies, the symptoms are very different in the two sexes. This is what is known as the Yentl syndrome. So named after the famous film Yentl, in which Barbara Streisand pretends to be a man in order to study.
For the 1000th time, men and women
have different obligations, I know, but
and don't ask why.
This syndrome describes women's medical invisibility in some pathologies, such as, for example, in heart attacks. Let's see what the symptoms of a heart attack are in a man and a woman. Men often show the symptoms of the famous Hollywood heart attack: pain in the chest and the left arm. For women, however, the symptoms are not always in the chest, but rather as epigastric pain, dyspnea, nausea and fatigue. So the diagnosis may be different in men and women. This problem is also frequent in pathologies such as axial spondyloarthritis. Although the main symptom of the disease is usually low back pain in men and women, in men it tends to produce more structural involvement. By contrast, women have less radiographic damage, but more peripheral involvement, more pain and fatigue. Note this fact: on their first visit, only 11% of women are correctly diagnosed compared to 30% of men. So the challenge is to be able to diagnose these pathologies at an early stage. And research breakthroughs mean we are getting closer and closer to doing that. The information from new studies is allowing us to better understand and identify the symptoms in both men and women, and use the appropriate treatment in each case to improve the quality of life of our patients.